So I'm Christine McIntosh. I'm not just the slide changer at these conferences. And I'm one of the GP liaisons at Te Whatu Ora County's Manukau, and you probably know me from COVID days, but I've gone back into my types of roles that I used to do around child health. But I'm also seconded to National Hawara Coalition at the moment, working on the Best Start Kauai. And my colleague Rochelle Inyon here is a nurse practitioner who is seconded in to fill my role as GP liaison child health or primary care advisor in child health at Te Whatu Ora County's Manukau. So I have, in my Te Whatu Ora time at the moment, I'm mostly focusing on immunisations, and I have spent time working with the National Task Force on the National Task Force report. So I was one of your GP colleagues who was involved in that National Task Force. I think that immunisations, I would have to say, is probably, dare I say it, the most important thing to talk about today, because it is the only thing other than clean water that takes the prize for the most important health intervention we can do to prevent morbidity and mortality. And I guess this comes as a slightly personal note from me, because my 3 uncles died in childhood from vaccine preventable diseases in the days before we had vaccines. And so for my family, I just recognise the trauma that created for my grandparents, and it's unnecessary now because we have good vaccines that prevent all of those diseases. So yes, we've got a task force on immunisation, and we came up with a whole number of recommendations, and I'm going to give you some snippets of that are particularly relevant to primary care. But I think the particular goals and the things that we really honed in on is that it's really important to get immunisations on time. And a lot of the time we're spending catching up on our populations who most need it. And if we're catching up, we've missed the boat somewhat, okay? We still need to do them, but we've missed getting that protection in early enough. We also need to do the catch-up for tamariki is really, really important. We're very behind because of COVID, but actually we never performed particularly well before that either. And this is particularly important for our Māori and Pacific populations. And that the target is 95% coverage. And that is the target for a very good reason, is because we need to get herd immunity for a lot of these things, but actually the individual immunity is critically important as well. So this is a pretty good summary, really, of where we've been, and you can see from 2009 to 2022, and what you can see there is there has been a persistent and resistant ethnicity gap in immunisation coverage, and we use the 6-month age. I know this has not been one of our targets historically, but we now know that actually this is a much better thing to look at, because what this tells us about is whether or not that child got their immunisations at the right time in the first 6 months of life. Now, we've recently had some pertussis deaths, and I suspect my colleague Bryn's going to talk about that. But these babies were not old enough yet to be immunised. They needed to have their mums to have their antenatal immunisations. But it's really, really important to get those immunisations in early. You can see the effect of the pandemic there, and you can see exactly the same thing, that inequity, it persists, and in fact it has actually widened in 2022. So this is from the task force report, and it really just reminds us that we do have distinct differences between our populations as to how much they are vaccinated on time and for those immunisations. And you can see, particularly for Māori, that actually by 12 months, getting those 12 months vaccinations and the measles vaccinations, we are really, really, really behind by then. And we have an incredibly vulnerable populations who are in communities together, and that really creates concern around measles. So these are the recommendations from the task force report, and there are a whole lot of recommendations in there. In fact, there are 54, but it is about expanding the workforce, because primary care general practice has principally been responsible for the immunisation of children, and to be honest, we've never really performed and closed that equity gap, so it's really time to think about things differently, use some of the thinking around the COVID response, and actually have a more collaborative way to get these immunisations done. But I'm just going to focus on a few of these today. Firstly, antenatal immunisations. So our pregnant people are eligible for flu vaccine, pertussis vaccine, and also COVID if they haven't had their COVID vaccine. But we do very poorly with this, and we did a lot of thinking about this during the task force about what the problems are as to why we don't have this done very well. And a lot of it is about knowing that they're pregnant, okay? And so for us in primary care, it's really, really important that we have some processes in primary care to remind us to get these things done, okay? So when you see people in early pregnancy, it's really important to set those reminders. So offer the flu vaccine now, and set that reminder for the pertussis vaccine. I'm just going to do a little shout out for the Best Start Kowai, which is an early pregnancy assessment tool that I'm working on with National Hawara Coalition. Te Whatu Ora funded, it doesn't cost you anything to use, and in fact if you use it for hapu mama Māori, you will in fact get some funding for your efforts as well as that hapu mama at the moment. So there you'll find that on the HealthPathways, and you'll find the details on that. Really important in that tool is it reminds you to set that recall for that pertussis vaccination in pregnancy. Okay, just a little reminder about what's new around that is that temporarily you get funded for both the flu vaccine and the pertussis vaccine to be given in pregnancy, okay? So previously you only got one set of funding, now you've got two sets of funding there temporarily, okay? Right, newborn enrolment. What was really interesting is to see what happens with newborn enrolment, because of course being enrolled in your practice is really, really important, because that's the way recalls get set and that's how recalls happen, and so if they're no longer enrolled with you, you don't bother recalling them again. So what we found through some really good work from Wing out at Counties Manukau and the Pop Health team is that in fact Māori have this really big gap. They have a pre-enrolment period when you accept that NIR nomination, but what happens if you don't confirm enrolment is they drop off your enrolment register at 12 weeks of age, 3 months of age, and this happens mostly for Māori, and that we've got a big gap there, okay? Clear inequity. So, when you get that newborn nomination, who accepts every newborn nomination into their practice no matter what? Show of hands. Got a few. Who rejects it? Nobody? Well, we've got one or two, because I understand there's some practices that are so full that they cannot accept newborn babies from a mum. Who rejects it if they don't know who the mother is in the practice? We've got one here. Who just leaves it hanging? And you might laugh, but they actually fall into a black hole if you leave them hanging, okay? And an alarm goes off at the NIR and tells us at 10 weeks of age this baby's not been vaccinated, okay? The one thing that we could do as a take-home message today is go back to your practice and find what your process actually is at your practice for your newborn enrolments, okay? You need to make sure you've got a good process for this. You need to make sure that it works well, because this seems to be where a major problem is happening, and actually a major inequity in immunisation is probably not intentional in many cases of this. It's certainly not intentional, but it's happening because we fall down in our systems within our practices. Okay, so that's one task I'd really want you to go and do. Okay, there are too many holes that can occur in this process that stops a baby getting fully enrolled in your practice and getting vaccinated on time. Newborn enrolment, we're going to get some clearer guidelines on how to assess eligibility in the practice, okay? It is, in entirely okay to accept that the parent qualifies under this and therefore the baby qualifies. So we're going to get some more guidelines for you on this, but it's really, really important that we don't put barriers to enrolment, because what we're hearing on the ground in South Auckland is that babies are getting turned away because they don't have a birth certificate. You do not need a birth certificate. There are other ways to show that that baby is eligible. Okay, so it's really important to check that whoever's responsibility it is in your practice to do the eligibility check knows what to do, okay? And your PHOs can help with that. We appear to be falling down in quite a major way in this area. Right, achieving equity. As I said, goodwill won't get us there and won't close the gap. It's really important that we start to do things differently. And this is the prioritisation matrix, which is now national policy. I've got 1 minute, but I'm going to go a little bit longer. And this is really saying that actually we have to do a very purposeful approach to equity. So when we have a Māori family, we need to prioritise their babies to get these immunisations. Okay? If we don't prioritise and we assume that everybody gets the same system, then we will continue to get the same result. All right, so I encourage you to become familiar with that national prioritisation framework and to consider how that is implemented in your practice. And I would say it's not just about immunisation. Take this approach to your newborn enrolment. What we do need to do is to create that confidence and that trust with healthcare again that has been somewhat impacted by the COVID pandemic, and we need to encourage our whānau Māori to come back into the practice, and it's okay for their babies to come and get vaccinated. Really important. Right, what else is new? Meningococcal B Bec 0, that has come out since the 1st of March. This is the one that you need to give, and you need to give a prescription of paracetamol with this one. They need 3 doses of paracetamol. Everyone familiar with that? I'm getting a few nods. Yep, and it is particularly really important to get it in for our babies. Okay, because they are most affected by meningococcal disease, but also notice that the criteria have created eligibility for groups at higher risk in our teenagers and early adults. So really important to add that Bec 0. Flu vaccine, okay, the important things to know about that is the expanded age range for Māori Pacific people, 55 to 64 years, okay, so make sure that your settings around what you're doing in your practice have taken account to that change in the criteria this year. Also notice the people under 65 with schizophrenia and mental health disorders are also included, so make sure that you're following up on those people. And also note that children aged 6 months to 12 years are all eligible this year for this, but I suggest you take a prioritisation matrix approach to that, okay? And we're just sort of hearing on the ground that many of the children are getting turned away from getting flu vaccine in practices. Just to let you know that pharmacies, if they're doing flu vaccines, are not doing infants, okay? Just be really clear on that. They're only going down to the age of 3 at the most. However, many pharmacies are not feeling confident to do the children. So please offer that within your practices, but offer it in a prioritisation type approach. Right, COVID and flu vaccination in Tamariki. The other thing that's come through is the infant COVID vaccine. There is a small group of children in the Metro Auckland area who are eligible for COVID vaccine under special criteria. They are a subgroup of the children who have previously been eligible for flu. And they're an important group because they are much more medically vulnerable. So what I would say is your PHOs have the list of these children. There's about 1,500 children across the region. They are whānau that we need to talk to as a general practice, because even if they don't want the COVID vaccine for their child, they are definitely a child that you should make sure that they're up to date with their vaccines and that they get their flu vaccine done this year. Okay, so if I'm going to say prioritise within your practice, please prioritise that group. Right, if you're feeling a bit bamboozled by it all and you're wondering how we're all going to get this sorted out and how we're going to do all these catch-ups and how we're going to cope with the headache, well, we thought about this at NHC and we've built you a Best Care IMS tool. This is something that we just built together. We just decided this was important. You can load it up into your practice management system, so it's available in MedTech, Indice, My Practice, and Kelly is here beside it. She's got a stand up at the morning tea. So look, it doesn't cost you anything to use this. We've just done it because it's the right thing to do. And honestly, seriously, we've just built it with our colleagues there. So if there's any feedback that you want to give me on it, I'm really happy to have that as well. But what it does is it helps you calculate what that child needs, and it calculates the quickest catch-up program for that child. Okay, I'm just adding in Big Zero. I'm just checking the logic behind it now. It should go live next week. Okay, and it's all in there. It just makes the job of the nurses a lot easier when they've got that kid in front of them knowing what they need to do. But you just need to make sure that their immunisation record's up to date before you do it. Okay, but really handy tool, really good feedback so far on that. Also recognising that what's happening now is a lot more access to vaccines. So for your pregnant mamas, many of them can get their vaccines done in pharmacies. Okay. And so important to use HealthPoint to look at all the other access points. Okay, so I'm gone over my time, but the key points really today are, please, immunisation is an incredible priority, and I know that you're all working incredibly hard and you're really under the pump, but it is something that we do have to put at the top of our priority list. And that I hope that you've got the message that if we're going to really shift that inequity that we've had in immunisation in our country, we really need to not just have goodwill that everything will work out okay, we have to do it quite purposefully in the way that we do our processes and our practices. And we really need to break down those barriers, some of which have become much greater barriers during the COVID pandemic, but it's really important that our whānau know that we're open for business, we're open for immunisation, and that we're ready to do that. And please do use the tools and the funding things that are in place and be aware of them, okay? Because that hopefully will make things a bit easier. We're trying to make sure that the funding follows the work, okay? Great, thank you.